everyone, I'm Dr. Natalie Teo, and today we're going to talk about something that 95% of men worry about unnecessarily. Yes, you heard that right. After more than 30 years in medical practice here in Singapore, I can tell you this with confidence, almost all of you watching this video are completely normal. But here's the shocking part. Did you know that in ancient Greece, a smaller size was actually considered the ideal? Big ones were seen as vulgar and lacking self-control. So if the beauty standards can flip completely like that, why are we still stressing over this, right? Today, I'm going to share with you the real science behind penile size, how to measure correctly, what the actual global averages are, and whether those enhancement procedures you see advertised everywhere actually work or not. More importantly, I'll answer the most common questions I get from my patients and from comments on my videos. Because let me tell you, in my 30 years of practice, I've heard every concern, every worry, and frankly, most of them are based on very unrealistic comparisons with what you see in adult films or online. Those images are not reality, okay? So let's start with something that might surprise you. This topic generates tremendous anxiety, misinformation, and unfortunately, a lot of unnecessary worry. The size question has become more and more common in medical consultations, online forums, and social media, especially with the increase in cosmetic genital procedures for men. Before we go further, let me reassure you with something important. Studies show that about 95% of men who worry about their size are actually within the normal medical range. Most of the time, we're not dealing with a physical problem at all, but rather a distorted perception of one's own body. Many men feel inadequate because of unrealistic comparisons, especially with what's shown in adult entertainment or on the internet, where bodies are often exaggerated or even digitally edited. And here's another interesting fact. This worry is much more common among men than among their partners. While more than 50% of men say they feel anxiety or dissatisfaction with their size, only about 5 to 10% of women say they consider size a very important factor in a partner. So take a deep breath, okay? My goal with this video is to educate, inform, and above all, help you have a clearer and more realistic view. Now, before we dive into the numbers, if you find this information helpful so far, do me a favor and hit that like button. It really helps me know that this kind of honest medical content is what you all want to see. And don't forget to subscribe if you haven't already, because I'll be sharing more videos about men's health issues that nobody else wants to talk about openly. Let me tell you, in Singapore especially, we tend not to discuss these things openly, right? Very paiseh. But as a doctor with over 30 years of experience treating men's health issues, I can tell you that keeping quiet about these concerns doesn't help anyone. So let's break down the facts together. First things first, how do you actually measure correctly? This is essential to know what's considered normal. There are two main dimensions to consider: length and girth, also called circumference or shaft perimeter. Let me walk you through this step by step, because I get so many patients who tell me they've been measuring wrongly all along. How to measure length? It can be measured both in the erect state and in the flaccid stretch state. Both methods are used in scientific studies, but the most reliable and consistent from a clinical point of view is the stretch flaccid length, as it correlates very well with erect length. Now let me tell you how to do it correctly. 1, use a ruler or measuring tape, not those soft tape measures that can stretch, okay? Use a proper rigid ruler. 2, place it starting from the pubic bone, exactly where the penis joins the body. You may need to gently press through the fat pad to reach the bone. I know, not the most comfortable thing to do, but this gives you the accurate measurement. 3, stretch the penis outward without forcing it, but firmly, and measure to the tip of the glans. If you're measuring when erect, do it the same way, from the pubic bone to the tip, with the ruler aligned along the shaft. It's important to avoid measuring from the skin or from underneath the penis, as this adds length and gives inaccurate results. Some men try to measure from the side or underneath, thinking it looks longer that way, but that's not how medical studies measure, so you're just fooling yourself lah. And how do you measure the circumference or girth? This is also fundamental and varies a lot between people. 1, take a flexible measuring tape or a piece of string. If you use string, mark it and then measure the string against the ruler. 2, wrap it around the middle part of the shaft, not too close to the base and not near the tip. 3, mark and record the measurement. You can do this in both flaccid and erect states, but most studies are based on the erect measurement. Many men overestimate or underestimate their size due to incorrect measuring methods or by comparing themselves with others in different states, which creates unrealistic expectations. I've had patients come to me convinced they were way below average, and after measuring properly with them, they realized they were smack in the middle of the normal range. The relief on their faces, I tell you, is something else. Now let me address a very common question I see in comments. One gentleman asked, my penis has a larger head. I've heard that if the head can pass through, the rest will follow. Should I measure the circumference of the head or the middle of the shaft? Excellent question. For medical purposes and for comparing with scientific data, we always measure the circumference at the mid-shaft, not at the head. The glands can be wider in some men, and that's perfectly normal, but the standard measurement is taken from the middle of the shaft because that's what the research studies use as their reference point. Now that we know how to measure correctly, let's look at what the science actually says. A large-scale scientific review analyzed data from almost 15,000 men worldwide. This type of analysis, called a meta-analysis, brings together multiple studies to obtain reliable averages. And trust me, these numbers are from real medical studies, not from what you see online or hear from your kakis at the coffee shop. Average length, when measured in erection or flaccid stretch, 90 to 95% of men fall within a range of 10 to 16 centimeters. That's between 4 and 6.3 inches for those of you who prefer imperial measurements. The global average is approximately 13.2 centimeters, which is just over 5 inches. This means that if you fall within this range, you're part of the vast majority. You're normal, okay? Nothing wrong with you at all. At the extremes, medical terms are used. We talk about micropenis when the stretched length is less than 7.5 centimeters, about 3 inches. On the other hand, a macropenis, which is extremely rare, is usually defined as larger than 24 centimeters. That's over 9 inches. I've been practicing for more than 30 years, and I can count on one hand how many times I've seen either extreme. It's very, very uncommon. Average circumference. The circumference or girth also varies but follows a common pattern in stretched flaccid state between 8 and 10. 5 centimeters, that's between 3 and 4 inches. In erection, between 10 and 13 centimeters or about 4 to 5 inches with an average of 11.5 centimeters. So when someone refers to average size, these are the real figures. The problem is that many people make comparisons with unrealistic standards, especially in the adult entertainment industry, where actors are selected for having unusual sizes and they use angles or editing to further exaggerate perception. The message here is clear. If you're within these ranges, you're in the absolute majority. And if you're outside them, it doesn't define your health, your attractiveness, or your masculinity. Let me repeat that because it's important. Your size does not determine your worth as a man or as a partner. Period. Now I want to address something I see quite often in the comments. Many of you share your measurements openly, and I appreciate that openness. Some of you say things like, I'm happy with my 12 centimeters, or mine is small at 12 centimeters, but I'm happy because when hard, it stays hard for 1 to 2 hours and satisfies my wife. You know what? That's exactly the right attitude, because here's something most men don't realize. Technique, attentiveness to your partner, communication, and stamina matter so much more than size alone. I've had countless female patients over the years tell me that their most satisfying experiences were not with the largest partners they've had. What mattered more was whether the man paid attention to what she liked, whether he was gentle or rough at the right times, whether he communicated, whether he spent time on foreplay. Size can matter to some extent, yes, but it's just one factor among many. And honestly, for most women, it's not even in the top 3 factors for sexual satisfaction. One comment I saw said something like, women nowadays are becoming more greedy. I understand the frustration behind this statement, but let me offer a different perspective. What's actually happening is that women are becoming more vocal about their needs and desires, which is a good thing, right? Like, open communication leads to better relationships. It doesn't mean they're demanding unrealistic things. It means they want partners who care about mutual pleasure, who are willing to learn and communicate. That's not greed, that's partnership. Another question someone asked was about how to scientifically increase testicular volume. Look, testicular size is largely genetic and doesn't significantly impact function unless we're talking about medical conditions. If you're concerned about testicular size for health reasons, that's something to discuss with a urologist. But if it's just for appearance, I'd ask you to think about why that matters to you. Our society puts too much emphasis on what things look like rather than how they work. Now, having said all that, I know some of you are still thinking, but Dr. Teo, is there any safe and effective way to increase size? Let me be completely clear about this. After 30 years in practice, I can tell you that it's completely normal to be curious about this topic. We live in a society that constantly bombards men with unrealistic expectations about their bodies. But if you're thinking about modifying something as delicate as your anatomy, it's essential to have the correct information because yes, there are procedures that promise results, but not all of them are safe and even fewer are actually necessary. Let's start with the methods for increasing girth or circumference. Nowadays, one of the most common procedures is the injection of hyaluronic acid. This substance exists naturally in our body and is also used in facial aesthetic treatments. When injected into the shaft of the penis, it can temporarily increase girth by about 2 to 3 centimeters. The effects usually last between 12 and 18 months and the body gradually reabsorbs it. This method is relatively safe as long as it's performed by a qualified professional with approved products. But here comes an important warning, and not all injectable materials are safe. Some clinics offer non-absorbable fillers like PMMA, polymethyl methacrylate, or even industrial silicone, which can cause nodules, infections, chronic inflammation, deformities, and irreversible damage. Therefore, I strongly advise against using these substances. Don't go to some cheap clinic just to save money, okay? This is your body we're talking about, not some car part you can just replace. And what about penis lengthening? Here, the scenario is more limited and riskier. There are 2 common procedures. One, pubic liposuction. Fat is removed from the base of the penis, which makes it appear longer, but this doesn't change the actual length of the organ. It just improves its visibility. If you have a significant fat pad, this can make a visual difference, but you're not actually gaining length. 2, cutting the suspensory ligament. This ligament holds the penis attached to the pubic bone. By cutting it, the penis hangs forward and may appear longer at rest, but there's a serious problem. It doesn't increase size during erection and can cause instability during intercourse. Moreover, the risks of complications, scarring, and post-operative frustration are high. I've seen men who regretted this procedure because sex became awkward without that structural support. That's why both the World Health Organization and many international medical associations don't recommend these procedures as a first option. In many cases, the aesthetic benefits don't outweigh the physical and emotional risks. I'm telling you this as someone who's seen the complications, not just read about them in textbooks. I also want to clarify something that generates confusion: penile implants. Although they appear online as supposed solutions to increase size, in reality they are designed to treat severe erectile dysfunction, not for aesthetic purposes. And they are medical devices used only when other therapies have failed. So if you're considering doing something about your size, the best tool you have is honest medical information. And it's also worth reflecting on why you want to change. Is it for yourself or because of comparisons coming from outside that may not have any foundation? Now let me share with you a fascinating cultural story that might completely change your perspective. In ancient Greece, the masculine ideal wasn't linked to a large penis size. Quite the opposite, actually. Wise, strong, and admired men were represented with small penises. Why? Because this was associated with self-control, rationality, and virtue. In contrast, large penises were seen as signs of excess, vulgarity, or lack of self-control. If you look at sculptures from that era, you'll notice that neither gods nor heroes had exaggerated sexual attributes. The exaggerated representations, like in the case of the god Priapus, were reserved for comedy or caricature. In other words, a large penis wasn't a symbol of power, but sometimes of ridicule. Can you imagine? What we stress about today was literally the opposite back then. What does this teach us? That beauty standards and masculinity change according to time and culture. What is promoted as desirable today may have been considered the opposite at another time in history. And if that's the case, why let something so variable define your self-esteem? Think about it lah. If people 2,000 years ago had completely different ideas about what was ideal, who's to say our current obsessions make any sense at all? The reality is that most anxieties about penis size have no basis in medical facts, but rather in social pressures, pornography, and misinformation. What's important isn't meeting an external ideal, but having a healthy relationship with your body and your sexuality. Size doesn't determine your value, your attractiveness, or your ability to give or receive pleasure. Now, I promised you some actionable advice, so here it is. If you're not satisfied with your size, what can you actually do? Well, first and foremost, improve your overall health. A healthier cardiovascular system means better blood flow, which means better erections. Seriously, exercise, stop smoking if you do, manage your blood pressure and cholesterol. These things make a bigger difference than any pill or cream being sold online. Second, reduce the fat pad around your pubic area if you have excess weight. This can make a significant visual difference without any surgery. Just by losing weight, some men gain a centimeter or two in visible length. It's the same length, but more of it is visible. Third, practice pelvic floor exercises, also known as Kegel exercises. These strengthen the muscles that support erections and can improve erection quality and stamina. And better stamina means better sexual experiences for both you and your partner. Fourth, and most importantly, work on your technique and communication. Learn what your partner likes, ask questions, pay attention, spend time on foreplay. These things matter so much more than size. I've had patients tell me their relationships improved dramatically just by starting to communicate openly about what they both wanted in bed. And finally, if this is really affecting your mental health and quality of life, consider talking to a counselor or therapist. Sometimes body image issues run deeper than just one body part, and addressing the underlying insecurity can be more helpful than any physical change. Before we wrap up, I want to say something to all of you watching, especially those of you who are older. You've lived through different eras, you've seen trends come and go. You know that so much of what society tells us is important is actually just noise. Your worth isn't in any measurement. It's in how you treat people, how you love, how you contribute to your family and community. I've been practicing medicine in Singapore for over 30 years now. I've treated thousands of patients, and you know what I've learned? The happiest men aren't the ones who fit some ideal physical standard. They're the ones who accept themselves, take care of their health, treat their partners with respect, and don't waste energy worrying about things that don't really matter in the grand scheme of life. So if this information has helped you see things in a better light, please subscribe to my channel for more real information about men's health, because that's my goal. Breaking myths, raising awareness, promoting empathy and honesty. We need to talk about these things openly and honestly, without shame and without all the misinformation that's out there. And here's what I'm going to talk about in my next video. 5 techniques to help you feel more confident in the bedroom, regardless of size. Because confidence, gentlemen, is the most attractive quality of all. I'll be sharing practical tips that actually work based on real medical knowledge and feedback from real couples, not from adult films or internet rumors. Thank you so much for watching all the way to the end. If you have questions or comments, leave them below. I do read them, and I often make videos addressing the most common questions I see. Take care of yourselves, take care of your health, and remember, you're doing just fine. I'll see you in the next video.